Let's get started. So my name is Courtney. I'm a pharmacist and a PhD student at the College of Pharmacy. The topic I'm sharing today is linking research and practice. We'll be discussing a variety of topics, but we'll be focusing on a few, including medical ethics, the COVID-19 pandemic, and vaccination. And like I mentioned, we're going to be using Slido today, so if you haven't already had a chance to do so, you can log in using the details on the slide. And I've also copied a link in the chat as well. And there will be a chance to ask questions at the end of the presentation, but if you do prefer to do so, you can type your question into the chat, and I'm hoping Toby can let me know if there is any questions that come up in the chat. So today I'm going to start off with a bit of a self-introduction, and then I'll also share a little bit about my thesis project, just to give you an idea of what type of research clinicians can be involved in. And then I'd like to go over the steps involved in clinical research processes, as well as the importance of ethics in research. And then I have 2 case studies we'll go through to show how we can apply research and ethics to real life scenarios. And then we'll end with a fun activity. So instead of going into detail on a specific topic, I thought it might be nice to give you an overview of a wide variety of topics. So bear with me and feel free to ask questions along the way. But just keep in mind that these are the main objectives for today's session. So appreciate the process of clinical research, appreciate ethical considerations in research, understand the scope of pharmacy practice, and understand how clinical practice influences research and how research influences clinical practice. So with clinical research, we often see a problem in practice, and then we can use research to find a solution, and then again, apply that answer or information back to practice. So it's kind of like a continuous cycle. All right, so a little bit about myself. I completed my undergraduate degree here in Winnipeg in the College of Pharmacy at the U of M. During my undergraduate degree, I did participate in quite a few summer research projects, and I would highly recommend that to anyone who is thinking about pursuing research. And these are some professors that I worked with during my summer research opportunities. And then after graduating with my Bachelor of Science in Pharmacy, I completed my licensing exams, an internship, and then I received my pharmacy practice license. So currently, I'm a community pharmacist at Shoppers Drug Mart. I'm also a PhD student in the College of Pharmacy, and my advisor is Dr. Cheryl Zeleninsky. I'm also a TA, guest lecturer, and seminar facilitator at the College of Pharmacy. And most recently, I actually started as a pharmacokinetic consultant at Alberta Blue Cross. So as you can see, I keep very busy, and I'd be happy to answer questions about any of my positions as well at the end. So now that you know a little bit more about me, I just wanted to get to know all of you a little bit more. So what is everyone's career aspirations? So if you want to log back into Slido. All right, I'll give you a few more seconds to put in your final answers. It looks like we have 34 votes so far. Okay, so it looks like most of you are interested in becoming a healthcare professional, which is really exciting. And then I think some of you are still exploring options, so that's also great to take your time. There's lots of options for you, so just wait until you find something that you're really passionate about. And then it looks like the third most common answer is clinician scientist. So I consider myself a clinician scientist, so I'm a clinician and a researcher, and I'm going to be talking a lot about that today, and kind of share why I think that's so exciting to be part of both fields. All right, so for those of you that are interested in the role of a clinician scientist, I just wanted to share a little bit more about my research, so you get an idea of what clinical research might look like. So my thesis project is on optimizing antimicrobial therapy in hemodialysis patients. More specifically, I'm performing a clinical pharmacokinetic study of cefazolin and ceftazidime in hemodialysis patients at St. Boniface Hospital. And for those of you that aren't familiar with the term pharmacokinetics, it's a study of drug levels in the body over time. So essentially with this study, what we want to do is study drug levels of cefazolin and ceftazidime in hemodialysis patients. So you may be wondering, what the heck is hemodialysis? So importantly, the kidneys, as I'm sure you're aware, are an organ in the body that filters blood and waste. It filters out fluid and waste from the blood. And then when patients have kidney failure, they receive dialysis. So they come into a clinic where the patient's blood is filtered through an artificial kidney called a dialysis machine. So you can see in this picture here an example of what a dialysis machine might look like. And then this is the dialysis filter that the patient's blood is filtered through. And then secondly, you may also be wondering why I'm studying hemodialysis patients specifically. So the first reason is that these patients are very complicated. They have a very complicated health status, including multiple chronic health conditions often, and kidney disease itself also weakens these patients' immune systems. So that means that if they have an infection, they're at a higher risk of poor outcomes like treatment failure or even death. And these patients also require vascular access to administer dialysis. So that's achieved either by using a catheter like this one, or by inserting dialysis needles that are inserted and removed at each dialysis session. So this direct access to the blood, it increases the chance that infections can occur, including serious infections such as bloodstream infections. These patients also have frequent contact with healthcare settings where they're exposed to a lot of pathogens, which increases their chance of getting infections. So ultimately, we see a high infection rate in this population, which results in high antibiotic use. And I think you guys learned this in one of your previous lectures, but antibiotic use is one of the main risk factors for developing resistance. So with that said, we want to make sure we're giving these patients the best treatments possible to cure their infection and to prevent the development of resistance. So why are we studying cefazolin and ceftazidime specifically? So I've included a figure here that shows the types of antibiotics and the frequency of use at our St. Boniface Hospital hemodialysis unit. And because a lot of the antibiotics are removed by the kidney, in kidney failure, we need to make large dosing adjustments to adjust for this because the kidney is no longer removing the drug. So in this graph, I've color-coded how much data we have available to help us properly adjust antibiotic dosing in hemodialysis. So in green, we have well-studied antibiotics, in yellow, poorly studied, and in red, antibiotics where no dosing has been studied in this population. So here you can see cefazolin and ceftazidime. They account for almost half of antibiotics that are used in our hemodialysis unit. But as you can see also, we have very little information on how to adjust dosing in this population. So with this lack of data, we end up making an educated guess where everybody gets the same dose. So one dose fits all approach, which as you can see here, Oprah is very upset about or excited about. Everybody's getting 2 grams of cefazolin. So a patient that weighs 60 kilograms or 150 kilograms would be getting in the same dose. So essentially, there's a lot of room here to research and figure out what the appropriate dose adjustments will be. So now you also have an idea why this research is so important. So I thought I would also share what the study process actually looks like. So I enroll patients at St. Boniface Hospital, and I do this by discussing the study with the patients and then obtaining their informed consent. And we enroll 20 patients for each antibiotic. And then the dialysis nurse draws blood samples before and after dialysis. So we do 3 blood samples per patient. And then I take the samples to a lab at St. Boniface and process the blood samples by centrifuging them. And this separates the serum from the whole blood. And that the serum is what we store, and then we transport it to the university. And we use this really high-tech machine here called the ultra high performance liquid chromatography dual mass spec. So essentially that machine measures the drug levels in our blood samples. So when people think of clinical research, this is what they think of. But what you may not realize is there's a lot that comes before and after these steps. So I wanted to take a minute to discuss those. So as we discussed a few slides ago, we identified a clinical issue. We have no information on how best to dose these 2 antibiotics in such a high-risk population. And then we developed a research question. So what is the best dose? And then we spent time developing a clinical study around that question, and we collaborated with nurses, doctors, pharmacists. We received multiple approvals from the Research Ethics Board and from St. Boniface Hospital to move forward with the study. We also applied for funding, and we ended up getting a grant from the Kidney Foundation of Canada, which was really exciting. So this process takes about a year or 2. So a lot of people don't realize the preparation that goes into clinical studies. And then after we measure the drug levels, what comes next? So one of the most important things is to analyze and really understand your data. So we have to make sense of it. And here we'll determine if our drug levels are too low or too high, and what does that mean as far as making a recommendation. And then the final and most important step would be sharing your results and recommendations so that the research can have an impact on practice. And this can be through publications, presentations, or even just speaking with other clinicians. So overall, the clinical research process, it is very complex and involves many steps, as you can see here. And it starts with obviously developing a research question, creating a proposal, applying for funding, applying for ethics approval, and there may be 2 other approvals that are required now. So there's a new privacy committee in Manitoba, and then also institutional approval. So for example, shared health, And then you will have to enroll patients, collect data, analyze that data and really understand it, and then share results and make recommendations. And here I highlighted ethical approval because I do think that it's a really important step to consider. So why is it so important? It protects the dignity, rights, and welfare of research participants. So because of this, there's a set of ethical standards of conduct for researchers. And that's also why research involving human beings should be reviewed by an ethics committee. And there's 4 main ethical principles that medical ethics are based upon. So beneficence, or the intent to do good. So is the research aimed at benefiting people? If not, then maybe you're asking the wrong question or researching the wrong topic. Non-maleficence, or intent to do no harm. So are there harms to the patients? And if so, do the benefits of the research outweigh the risks? That's an important question to ask, because we don't want to be doing research that is creating a lot of harm to a patient with little benefit. And then next, autonomy, or freedom of choice. So do researchers honor patients' right to make an informed decision about participating in the study or not? And then justice, or fair treatment and care to all patients. So what happens when ethics are not considered in research? So there was a study in 1932 called the Tuskegee Study of Untreated Syphilis in the Negro Male, which is now referred to as the USPHS Syphilis Study at Tuskegee. And the goal of this study was to record the natural history of syphilis in 600 Black men. And these men, 399 had syphilis and 201 did not have syphilis. And they were rewarded with free medical exams, free meals, and burial insurance. So some of the concerns we had with this study was that the patients, the researchers did not obtain informed consent from participants, and the participants were told that they were being treated for bad blood. Which is a term that was used back then to describe several ailments like syphilis, anemia, or fatigue. So the patients really didn't have an idea of what the study was all about and what they were participating in. And then the second concern was that in 1943, penicillin was widely available and it was being used to treat syphilis. However, participants in this study were not offered treatment. So these patients thought that they were being treated for syphilis, although they weren't being offered this new treatment that was available. So as you can see, the study violated multiple basic ethical principles of, first of all, respect for autonomy. So the participants were not informed enough in order to make a decision about participating in the study or not. Non-maleficence was also violated because the patients were harmed because treatment was withheld after it became the treatment of choice. And then also justice was violated because only African Americans were recruited in the study. So this is just an example of why it's so important to consider ethics in research. So when COVID-19 hit, many clinical studies were suspended to protect research participants and the community at large. And this can kind of tie back to some of our ethical principles that we discussed. So making sure that we're not doing harm to our research participants and making sure we're not doing harm to our community at large as well. So unfortunately, my clinical study was suspended for over a year, but I did still have a large connection to research as a clinician, but in a very different way. So from a clinical point of view, COVID-19 had a huge impact on pharmacy. So there was a huge demand for COVID-19 research and sharing of information. So we saw a huge rush of knowledge, and I remember spending a lot of time reading research to stay up to date on current recommendations and other information that was becoming available. And And when I graduated, I took the oath of the pharmacist, which you can see here on this slide. And it states, I will keep abreast of developments and maintain professional competency in my profession of pharmacy. So part of that oath was keeping up to date on current research, which became very important during COVID-19. So before I kind of explain the impacts of COVID-19 on pharmacy as far as changes to clinical roles, I thought it would be relevant to discuss what is a typical role of a pharmacist. So I'm going to ask another poll question. So other than safely providing medications to patients, what else can pharmacists do? All right, I'll give you a couple more seconds to type in your answer, but what everybody's been saying so far is awesome. So yes, the main thing that a pharmacist can do is advise patients and inform them. So education is a really big part of community pharmacy, at least. So providing counseling, educating patients on not just their medications, but their health conditions. And that became very important during COVID-19 as well. It looks like there's a lot of other points here. I'm not going to go into all of them, but definitely a lot of good points. So thanks everyone for participating in that. So here was a couple other points that I thought of. So counseling, like we mentioned, recommending treatments for self-limiting conditions over the counter. So a lot of people will come in with a cold or a sore back, and you can recommend something for them. And that prevents the overwhelming the healthcare system, like getting an appointment with the doctor when the pharmacist can just help right over the counter. Pharmacists can also prescribe, so they can prescribe for uncomplicated bladder infections, which is something that is actually new since COVID-19. Prescribe for smoking cessation and other self-limiting conditions. Some of those things are like allergies, or eczema or fungal infections are just a few. Pharmacists can also immunize, order lab tests, and perform medication reviews. So there was also changes to the clinical roles of the pharmacist. So a main thing was that it was harder for patients to see their doctors. So a lot of questions, including questions about COVID-19, were shifted to pharmacists that were more accessible. And questions really spanned from, do you think I have COVID, to I have cancer, I'm worried about having COVID, how can I prevent getting COVID? What is the best mask to wear? What vaccine should I get? So essentially pharmacists really had to do their research and be prepared to answer these types of questions for patients, or at least let patients know where they can find the answer themselves. And then Obviously, I'm sure you're aware, pharmacists also played a large role in COVID-19 vaccinations. So that was a topic that I had to stay up to date on. And then now pharmacists can also perform asymptomatic COVID-19 rapid tests. So here I have a little picture of pharmacy making the headlines. So with a huge demand that was seen for vaccinations. So this was at Shoppers Osborne, and I worked a few shifts there at their immunization clinic. This is actually a picture of me and my little cousin Ellie. She's actually only 4 years old, but she came in with her parents and saw them getting vaccinated and she felt left out. So I gave her a little Band-Aid. So I thought it was really cute. Now I just wanted to go through a few case studies just to show how research and ethics can be applied to practice. So our first case here is a patient comes into the pharmacy. She says she is scared to get the COVID-19 vaccine. She asks if it is true that mRNA vaccines can cause changes to your DNA. So my question is, how can we use research and evidence to help this patient? So I have another poll question. So what do you think are common reasons for vaccine hesitancy? All right, so it looks like right in the center there, misinformation. So that is absolutely true. That is going to be something that I'm going to talk a little bit more about as well. I'm seeing here lack of knowledge, ignorance definitely can play a role in vaccine hesitancy, fear of side effects, conflicting views, distrust, that's a big one as well. Yeah, absolutely. So that's great. Thanks everybody for putting in your ideas. Oops. All right, so I kind of took a little bit of time to research what the common reasons were for vaccine hesitancy. So research has shown that the reasons for vaccine hesitancy are actually very complex, and they do actually encompass more than just a knowledge deficit or fear of needles. So the WHO, or World Health Organization, has a group of reasons for vaccine hesitancy, and they divided it into 3 groups. So the first being lack of confidence. So that can be in efficacy, safety, the system, or even policymakers. And some of this mistrust and lack of confidence stems from harms of the past, such as the Tuskegee syphilis study or other ongoing discrimination that is seen in healthcare still. Other fears may be based on misinformation, like a lot of you said in the poll. And a survey has been published that showed that online misinformation is actually correlated with vaccine hesitancy rates. So that's something really important to consider. And then the second group here is complacency. So a perceived low risk of acquiring a vaccine preventable disease. And then the third, a lack of convenience. So for example, maybe a patient doesn't have access to a vaccine clinic that's convenient for them. So decision-making around vaccination, it really entails a complex mix of cultural, psychosocial, spiritual, political, and cognitive factors. So this study by the CDC, it really shows this. So this is a map that shows estimates of COVID-19 vaccine hesitancy rates across the US. And they use data from the US Consensus Bureau's Household Pulse Survey. So we can really see a distribution of hesitancy across the geographic location. So if something as simple as fear of needles was the main driver of vaccine hesitancy, we wouldn't expect to see this type of variation. So I thought that was something really interesting. And like I mentioned, misinformation can play a role in vaccine hesitancy. And what is really concerning is that I found this article published in Social Science that found that false news spreads faster, farther, deeper, and more broadly on Twitter than true news. So that can also explain how some of this misinformation is spread so fast and can play a role in creating a lot of vaccine hesitancy. So with all the misinformation that is out there, it's so important to do your research and stay up to date. And by understanding available vaccines, including the mechanism of action, efficacy, and risks, we can educate our patients on the truth and clarify any misinformation. So in our case, our patient asked if mRNA vaccines change our DNA. And by understanding the science and research behind mRNA vaccines, we can explain to our patient that no, mRNA vaccines do not change our DNA. Some other misconceptions I've also heard are things like you can get sick with COVID-19 if you get the COVID-19 vaccine. The government added microchips to the vaccine to track your whereabouts. The vaccine can make you magnetic. That it's safer to get natural COVID-19 infection than to get the COVID-19 vaccine. So all these misconceptions can be disproven by research and evidence, and it's important to understand that so you can really explain that to our patients. So that concludes our first case. Our second case here, a patient comes into the pharmacy and they ask you why his workplace is forcing him to get a COVID-19 vaccine. And he thinks that it's unethical. He said he doesn't think he needs the vaccine because he is young and healthy. So how can we use research and evidence to help educate this patient? And are vaccine mandates ethical? So what does the research say? So we know that COVID-19 has created a grave threat to public health, resulting in death, hospitalization, and healthcare overcapacity issues as well. Research has also shown that vaccines are safe and effective, and that their benefits outweigh their risks. And then finally, we know that self-vaccination can also protect others, especially vulnerable patients at higher risk of severe outcomes. And that could include hemodialysis patients like we discussed earlier. And then the last question, are vaccine mandates ethical? Essentially, it's a very complex question, and it definitely can be debated. So I don't think there is a clear answer. But we can see here, based on our ethical principles, that vaccine mandates can be justified by beneficence, non-maleficence, and justice. So beneficence, we know the vaccines are effective and safe to prevent burden of COVID-19. They benefit individuals and the community. For non-maleficence, we have minimal harm, so minimal rates of side effects. And then also we reduce harms of COVID-19. As far as justice, vaccines prevent hospitalizations. They can reduce healthcare worker shortages and protect healthcare system capacity. But you also do see here in red that vaccine mandates do violate the principle of autonomy. So that's why we don't have a clear-cut answer to this question. And it can just show how complicated some healthcare questions and decisions can be. So I personally believe that vaccine mandates do have their place in certain situations. For example, when I started pharmacy, it was mandatory that I was up to date on my vaccinations, including things like my hepatitis vaccine. And this was understandable and logical to me, just to protect myself and patients in certain healthcare scenarios. So that concludes my presentation. I appreciate everybody's attention, and I hope you took something away from the presentation. And just before we start our activity, does anybody have any questions they would like to ask?